Hello, dear colleagues. I am Dr. Luca Boschini from Rimini, an icy side town of Italy. Today, with my friends Dr. Michele Melillo, I'm going to talk about a nice device that permits a simplification of the most common surgery. Let's go. This technique that simplifies the surgery is called magnetic dynamic technique and requires the use of the magnetic mallet, which currently is the only device in the market that generates an electromagnetic thrust to the instrument we are using. The magnetic mallet consists of a central unit, an handpiece, and the instrument such as extractors, osteotomes, and blades. There are four levers of power to select via a rotary control knob on the front of the unit and a foot switch to import the impulse to the instrument we are using. The same with the button in the front of the unit. If we push the button, we import the impulse as the foot switch. Let's see the unique feature of the magnetic mallet. Through an electromagnetic acceleration, it generates a controlled movement of the instrument. So this is not a pneumatic or electric technology. It works with several different instruments to execute an ample number of procedures. We can do extraction, we can do sinus lifting, we can do site preparation for implant, a lot of surgeries. In fact, it consists on two tools in one, since on the same handpiece we have the mallet and the instrument. This advantage is not insignificant because it leaves one of our hands completely free. With one hand we use the handpiece, with the other hands we can protect the soft tissues, for example, the tongue. The run of the motion is extremely controlled and constant at 1.1 millimeter, regardless of the power we set or the density of the bone we are working on. So, why have we to use magnetic mallet? Or better, why not? We have a lot of advantages. At first, the benefit of the magnetic dynamic technique are mainly related to the improvement of the field of the view, since the instrument does not generate any heat of the bone, therefore do not need the use of the irrigation water, something that we need with drills or piezo or sonic instrument. The device allows to use the instrument very precisely, as the force are accurately imported on the target area. Instead, when we use a traditional manual mallet, we always have to expect micro deviation due to the movement of our arm and the different bone density that affect the actual motion of the same. Control is also an important factor, as we are using one hand only, as we said before, while the manual mallet required the use of both hands. Both the force and the motion are controlled and constant. This is a significant aspect in terms of safety. It allows faster procedures, it is very ergonomic and bone loss free. This aspect is particularly differentiating to the magnetic mallet by the rest of the devices we typically use, because it shapes and expands the bone instead of removing it. This does not mean that we have to forget about some surgery or piezo surgery or the drill. It is just very useful to know that some of the procedures we that we traditionally do might be replaced by a new one that avoids to remove bone. Moreover, compared on the manual mallet, we observe a better experience of the patient and almost no case of BPPV. For what concerns the application of the magnetic mallet, clean extraction is clearly the one that makes us to use it every day, multiple times a day. Extraction are made without any aerosol, since irrigation water is not needed, and without blood spatter. The patient is more comfortable as does not feel the need for deglutition. This is a daily experience when we are working with water. I also want to underline again the better visibility for us. This is one of the most important aspects of the magnetic mallet. This is, for example, a video about the use of the surgical handpiece, where you can appreciate the water accumulation in the mouth and the aerosol produced and the spatter produced. When using the magnetic mallet, we completely bypass these two aspects, because also in case of crownless teeth, where we usually have to work with a drill or a piezo, this problem does not hold good, as we can do the entire procedures tear-free and cut-free with the magnetic mallet. Compared to manual osteotomy, as we said, we have a better control and a sensible higher efficiency of the force applied. This graphic shows data collected by sensors during tests run at the University of Milan in Italy. Observing the purple line, this one, okay, we can appreciate the effect of a strike delivered manually on the bone, which clearly highlights how the energy is dissipating during a relatively long time. Here, a long time, without a peak like in these other curves. This is what we can define as pushing instead of shaping for the manual use of the hammer. As you can see, already the lowest power of the magnetic mallet, the black line, this one, okay, delivers a force which is higher than that produced by manual mallet. Besides that, it is concentrated on a shorter time, which is what reduced to almost zero the generation of shock waves. That's what the patient feels using a manual mallet, and makes many of us refraining by executing this traditional technique. We can summarize this graphic with two main aspects: very high efficiency in modeling or shaping the bone in a controlled way, a very controlled way, because we have only a little execution of the tip, 1.1 millimeter. The magnetic mallet is a real an Italian masterpiece. Okay, what about its application? I think one of the easier but best application of the magnetic mallet is in the extractions. There are different instruments to be used for the extraction. Each of them has a straight shape version and an offset version for better access to the posterior regions. Okay, this video animation shows very well the way that the extraction instruments of the magnetic mallet works. As you can see, as a blade penetrates, it breaks the PDL fiber, separating the root by the bone with a lifting action. Okay, with a lifting action. Therefore, even in case of absence of grip for a force, with the magnetic mallet we manage to mobilize the root and complete the extraction. Okay, perfect. Okay, this is another extraction case to appreciate how we can preserve the alveolus in case of multi-rooted tooth. The zero bone loss procedure facilitates a post-extraction implant placement, as the bone between the roots and the crest are completely saved and available for the implant site preparation. This is another case extraction of semi-impacted third molar. This is the case, okay? This is the position of the tooth. In this case, we have extracted the second molar, this tooth, and subsequently the third molar has been placed in the position of the second one. So we did an auto-transplantation of the third molar in the second molar position. First of all, the second molar was separated to the first molar with a bar, and the tooth was pushed in the first molar direction in order to find an exit way. With the instrument of the magnetic mallet used vestibularly and nasally, we have completely mobilized the tooth and finally extracted. The extraction has been performed without teeth separation, root separation, despite their initial position. This is a coloring to highlight the way the magnetic mallet has minimally affected the integrity of the root. The PDL has been removed just on a limited area of the root. After that, the third molar was activated with orthodontic devices. And finally, after 1 month, extracted to be placed in the second molar position using a replica. And this is the final image of the surgery. Time 0 and 1 year follow-up. For wisdom teeth, and specifically for crownless teeth, the use of drills or piezosurgery is nearly mandatory. The magnetic mallet represents an alternative, as we can achieve the same result avoiding the use of more invasive devices. In this case, once the root emergency has been isolated, we started with the thinner extraction penetrating the bone and delicately pulsating the tooth, as you can see in the video. We continue with the thicker extractor to facilitate the action of the lever. This one that you are watching is the full video of the procedure with the actual time of the execution. Only the instruments change on the handpiece time has been cut. Okay, what is particularly interesting in this video is that we can appreciate as it's possible to associate the impulse of the instrument to the twist of the same for the same time lever action. Okay, we use the instrument as a manual lever. Other 2 or 3 seconds. Okay, and here's the extraction. You can appreciate the perfect way the alveolus is preserved. The procedure has been quite simplified by the use of this technology. And this is the root, the extracted root. Okay. Let's go. I leave the word to my friend Melillo. I want to start with the video without voiceover. Enjoy the video and enjoy the presentation of Melillo that will show you other field of utilization of the magnetic dynamic technique. See you, bye bye.
Oh, what a day, yeah, take it easy today. But you're the one I meet, and I keep on working. I can see that the trees are calling back the leaves. Sunday was a sharing day, but I keep on working. Oh, what a day, yeah, take it easy
This is Dr. Michele Melillo speaking, and I'll talk about the site preparation using the magnetic mallet. For what concerns the implant site preparation, the magnetic dynamic technology represents a great innovation in dentistry. Let's immediately see a case of drills-free implant site preparation with magnetic mallet on a previously extracted incisor. The osteotomes used with a handpiece allowed to prepare the site, saving the 100% of the bone in this aesthetic region, also distracting the vestibular bone in order to preserve and improve the volumes. This is the implant and aesthetic result, and the case is a courtesy of Dr. Luigi Cannullo from Rome, Italy. As you can see from the picture, it is truly remarkable the increase of the volume, thanks to the alveolus preservation achieved with the magnetic mallet, but especially due to the bone expansion obtaining during the implant site preparation executed with the osteotomes of the magnetic mallet. And this is the 4-year post-op control, the X-ray and the picture of the final result. Let's see now an even more explanatory video on how the implant site preparation through the magnetic dynamic technique works. In this case, it was not necessary to obtain a vertical augmentation of the crest. The use of the device in the maxillary bone, that we know to be less mineralized, therefore softer than the bone in the mandible, allows us to entirely preserve the bone during the implant site preservation, as the bone is not removed as with the drills, but reshaped, expanded, and condensed with the osteotomes. The first instrument replaced the pilot drill, as it is very sharp with a high capacity of penetration and allow us to reach immediately the length of the osteotomy that we planned. The sequence continues with the other osteotomes, progressively larger, that expand and condense the bone. We obtain therefore an osteodensification and at the same time a bone expansion effect. As you can see, the instruments have an increasing diameter and are used until the diameter of the implant site is slightly underprepared compared to the diameter of the implant we plan to place. The possibility to twist the instrument allows to passivate it and therefore extract it very easily. We can also appreciate the use of the offset instrument that facilitates the use of the posterior region, and finally the implant placement. As you can see, the vestibular shape has been remodeled and increased as an effect of the distraction performed with magnetic mallet. Finally, we use the wrench and we can verify the torque value, which is above 50 Newton. Being the primary stability more than satisfactory, also the healing cap has been positioned. This is the picture after suturing, and as you can see, the tissue lay on the healing cap starting to replicate a good effect. Here's some picture that highlights how on a thin crest of a lateral incisor, where we typically would have had to perform expansion procedures such as ridge split or GBR, Through the use of, instead of the magnetic mallet instrument in a progressively larger diameter sequence, we can directly prepare the site anteriorly shaped by dislocating the bone. In this image, we can appreciate the implant site prepared as just described. Therefore, we have obtained an implant site diameter large enough to place an implant, avoiding regenerative procedures. This one is a more complex case. Here, there is the CT scan that shows as this atrophy required a total bone regeneration to perform a full arch rehabilitation. But we have instead decided to bypass the GBR by placing the implants in the residual bone of the central region, so here, the central region, here, and the lateral canine region, so here and here, with some tilted implants. But being this a third skeletal class, as we can appreciate on the images, in order to balance the forces, we have decided to place 2 more implants on the maxillary tuberosity. We know that in this particular region, we have a soft bone, a D4 bore or softer, so we opted for the use of the magnetic mallet osteotomes instead of drills. This is the plan of the implant insertion. This is the procedures with the initial situation, the incision, the opening on the flap, and the atrophy shown on the canine area is well visible. We started drills in the incisal area. For this area, the bone is harder, and then we prepare the side of the canine zone only using the magnetic mallet osteotomes. These are the first 4 implants, with the drills positioned in order to verify the position of the axis. These are the implants during the placement and the implants in the tuber region, which is very posterior and with a very soft bone. The implant site preparation has been completely safe since the magnetic mallet is very safe when we work near a risky area. This is the multi-unit abutment positioning and the impression and the delivery of the temporary prosthesis. What is interesting to observe at the control after the loading is how the implant in position 5th has been placed next to the mesial wall of the sinus thanks to the drills-free preparation that has also dislocated part of the sinus floor by expansion effect, allowing to place an implant completely inside the bone without any risk of perforation. The 2 implants in the tuber, where is usually expected a low primary stability, thanks to this kind of preparation, reached an elevated primary stability of about 50 Newton. Therefore, it has been possible to load immediately, granting a better stability of the prosthesis. Another application is on the crestal sinus lift, where with the magnetic dynamic preparation we can not only expand and condense the bone, but at the same time obtain a vertical increase. This is a video animation that shows how one reached the sinus floor using progressively larger osteotomes. We can first fracture and then elevate the sinus floor. We can also use the osteotome to place and condense the biomaterial below the membrane. There are also other procedures, such as the possibility to create a bone block. And then vertically push the membrane. After placing some biomaterial, the same can be compacted, always using the instruments of the magnetic mallet. Therefore, with one device, it's possible to fracture, to condense, to shape the bone, and then to place and compact the biomaterial. In this case, with an expanded sinus, it was necessary to perform a mini sinus lift. So this is the site preparation, the biomaterial insertion, and the implant placing. As we can see in the X-ray, the blue line is the initial sinus floor, and the red line highlights the result obtained after the procedures. And below the yellow line, we can still appreciate the cortical bone block dislocate when fracturing here. In this other last case, we have a residual bone of 6.8 millimeters. So to place a 9 or 10 millimeters implant, it was necessary to perform a sinus lift procedure. It has been possible to execute a drills-free procedure only using the magnetic mallet osteotomes. This is the video of the procedures. So the baseline. After the incision of the soft tissue, we wanted to perform a minimal invasive procedures. We have elevated a flap. This video is mostly in real time. So after exposing the crest, we started with the first pilot osteotomes. With these osteotomes, we determine the axis of the implant and mark its entering position. The first instrument stops 1 or 2 millimeters from the sinus floor. Then with the second instrument, we start to fracture and shape the floor. In this case, we started with a low power, 1 or 2. Then according to the density of the bone, we can decide if it's necessary to increase the power to 3. Only in few time to the power 4. I often use to twist the insert. When the insert stop because there is too much resistance, we can pass to the third instrument. With this one, we use it to slightly expand the crest. Twisting allows to passivate the instrument and disengage it from the walls. Afterward, we use again a smaller diameter here, because with the smaller instrument we have a complete passivation on the wall and allows us to easily execute the fracture of the floor. When the fracture is done, we can start again with a bigger instrument that will engage the walls and proceed at 1.1 millimeter per pulse with a very low risk of teetering the membrane. So we go back to the smaller instrument to fracture more the sinus floor. After verifying the integrity of the membrane, we proceed with elevating the sinus through the instrument. Once reached the desired length, the implant is placed. In this case, we didn't use any biomaterial, as we considered the presence of the bone block, and for me it was enough. The primary stability was satisfactory, therefore the healing cap was placed. After checking the torque value, we started with the suture. This is a modified continuous suture to have a good compression of the soft tissue. In this case, having placed also the healing screw, the healing cap, we could perform the soft tissue translation and obtain a good aesthetic result from the first surgery. The suture I used is a resorbable suture. Okay, this is the post-operative X-rays, and we can appreciate the dislocation and elevation of the sinus floor. The soft tissue situation. So, thank you for watching and greetings from Italy. Ciao!
The Magnetic Mallet uses advanced technology for minimally invasive surgeries. Try it yourself.